Right, I am joined by the very, very lovely Dr. Abha Bhat from Art Fertility. Hello.
Hello, Sarah. How are you?
I'm really well. Thank you so much for, giving me your time this morning, because I know you're in clinic and you're very, very busy. So thank you.
Oh, you're most welcome. It's my pleasure.
Well, now today I wanted to pick your brains about basically the way that lifestyle factors can affect fertility. And I'd love today to find out what we as patients or people that are trying to conceive can do to help themselves by just perhaps making some slight lifestyle changes. So I've got my list of things here that I'd love to just ask you about. But before we begin, can you tell me what sort of lifestyle factors do affect fertility? What are the main things that can actually reduce your chances of conceiving?
Okay. Well, I think with our modern ways of living, our culture, our thought processes, so many things have changed in our lives, which have directly or indirectly had an impact on almost every aspect, and especially so the fertility. And I think it's taken some time for us to realize how much of an impact all these lifestyle changes have made on our fertility. Especially, the stress that comes with our work and our social life, the cultural habits, our diet, which which puts us at risk of having an excessive weight, smoking, alcohol. Some people are used to taking recreational drugs. All these and more can have an effect on fertility, both in the males and in the females. So yes, the first step is awareness, and then we need to all start thinking in terms of how we can improve our lifestyle, so that we can go back to nature and we can go back to the fertility that the nature intended for us.
Yes, yeah. I think there's something quite powerful about taking as much control of your fertility as you can. And by that, I mean, looking at your weight, looking at what you're eating, reducing alcohol consumption. I think once you've ticked all those things off, it's mentally quite powerful to know that you are doing everything you can. And it took me a very long time actually to realize that I should be doing those things. And when I finally did, mentally, I felt a lot better. Can I just start with weight? So am I right in thinking that your BMI, which is your body mass index, should be less than a certain level? What is that?
Body mass index is calculated by dividing the weight in kilograms by the height in meters squared. So the normal BMI is expected to be between 19 and 25. And in women who have a BMI of over 25, they are, they can expect that if this weight would have an would have an impact on their fertility. And even more so if their BMI is more than 30.
Right.
Similarly, if the BMI is less than 19, again, there can be an impact on fertility. Women may stop having cycles, stop having ovulation, and have fertility problems.
Wow. Okay. So I had a woman yesterday message me saying that her BMI was over 30. So she actually really does need to reduce that then before she starts trying IVF, really, doesn't she then?
Well, yes. If her BMI is over 30 and less than 35, yes, she does need to start incorporating lifestyle modifications so that she starts losing weight. And because not only fertility, but also her risk of miscarriage is higher than if her BMI was normal. And if her BMI is over 35, that would actually put her at a great risk of having a pregnancy in the first place. The only downside is, I don't know what her age is, so she may or may not have the time to to allow herself to lose weight, because at the same time with her increasing age, her fertility is also going down. So it's a balancing act.
Yes. And actually that brings me on to the topic of stress, because we're told reduce your stress levels because stress can affect fertility. But if you're, when you're stressing about losing weight and the time slipping away and not getting pregnant, it's very difficult to manage that stress. But I am right in thinking, aren't I, that stress really does affect fertility?
Well, yes, several studies have indicated that stress can have an impact on male as well as female fertility. It can have an impact on the hormones and therefore affect the way our ovulation happens, or in case of men, the way the sperms are produced. So yes, as you said, trying to lose weight can be stressful, but at the same time, I think it's modulating how you think about it. And if you change the way and accept, okay, I am overweight, this is what I am. So once you accept what the situation is and are aware of what you're supposed to do and do it in a positive manner and start losing weight, start having a reasonable amount of time that you devote to physical exercise, as well as have sensible diet at the same time, not engaging in excessive dieting or extreme diets. That can actually help reduce the stress too. So exercise is not just to lose weight, but also it can be a stress buster if you like.
Yes, yeah, that's very true. And there's also ways, other ways that you can manage stress. I found writing my thoughts and fears and anxieties down in a journal, I found that very calming. Acupuncture, wonderful things like that. Do you encourage your patients to do acupuncture and things like that, and yoga?
Yes, I talk to patients, and because all 5 fingers are different, all people are also different, and different people find that different things help them, relieve their stress and anxiety. So I encourage them to do whatever it is that they enjoy doing, and that distracts them from that, thought process and the stress of not being able to have a child. So and I believe yoga is also quite helpful. Acupuncture, yes, there have been studies which have suggested acupuncture helps, but I think the studies are a little inconsistent. The evidence is not very strong, so I don't insist on it. I leave the choice to the patient. So there are some of my patients who enjoy engaging in that, and others do not opt for it, and I do not insist in it.
Yeah. It's a lot to do about with self-care and self-love, right? And just taking that time just to look after you. I think that's one very special thing. And with staying on the diet and eating well, because we hear a lot about the Mediterranean diet when trying to conceive. Basically just eating lots of fish and vegetables. Again, is that something that you encourage your patients to do?
Yes, I do. Mediterranean diet is quite rich in omega-3 fatty acids, and fruits and veggies have a lot of antioxidants too. So that helps in reducing the reactive oxygen species, as we call them, that have an impact on fertility decline, due to environmental pollutants and a lot of things that we do in our day-to-day life, and there has been some beneficial effect. So yes, I do encourage my patients, those who are non-vegetarian, to go for a Mediterranean diet. Those who are vegetarian, I suggest they go for a healthy diet which has lots of fruits and vegetables. Rather than fruit juices or vegetable juices, I encourage them to have it raw, without taking out the fiber.
And what about caffeine consumption? For the coffee lovers, do we have to limit ourselves, or are we good to go with the coffee?
Well, studies have been quite inconsistent with what caffeine does to, fertility. So what I tell my patients is a moderate consumption of caffeine is okay, because I know those of us who are used to caffeine would actually get stressed if we don't have our daily dose. So it's okay to continue moderate caffeine consumption, that is what I tell my patients. They can continue as long as it's not very excessive.
Yes. Does the same apply for alcohol?
Oh no, alcohol is a different ballgame. So, alcohol has an impact on fertility, both in men and women. In men, almost on a dose uh, dose-related manner, alcohol consumption can have an impact on the sperm parameters. So sperm numbers, motility, and the structure of sperms can be affected. The more you consume, the more effect it has. And even in those men whose sperm parameters are normal on analysis, they seem to have a higher chance of miscarriage and lower pregnancy rates. So, but currently we are a little partial towards men, I think, and most of fertility clinics would be okay if the man consumed no more than 3 to 4 units per week. In case of women, on the other hand, we are quite stringent because even in women, alcohol has an impact on fertility, but we are even more concerned because of the baby that might start because of the fertility treatment, either naturally or through artificial reproductive techniques. And we don't want the baby to be affected. So we suggest to the women to have as little, if not to abstain from alcohol completely.
And of course, smoking, that is a complete no-no, right?
Yes, it's a complete no-no for smoking, especially for women, because that causes a very rapid depletion in the ovarian follicle. So their fertility goes down, the number of eggs in the ovary goes down. Their chances of miscarriage are almost twice as much as non-smokers. Their chances, even if a pregnancy happens, the baby's growth is affected. Baby may be born preterm, and the baby is at risk of complications even after birth. So yes, for a woman, smoking is a complete no-no. Even for a man, smoking has an impact on the sperm parameters, and ideally nobody should smoke. If they ask me, I tell them, if you can go on a smoking cessation program, that would be great.
Yes. All of this makes so much sense when you hear it, and it sounds obvious, but really, I go back to myself because I can use it as a comparison. When I realized I wanted to get pregnant, I didn't once think or look at my lifestyle. I just assumed it would happen. I never really had anybody say to me, now listen, this is what you need to do. And I wish I'd had more fertility education actually at a younger age. I think a lot of women and men I know feel the same.
Yes. So kudos to you and your organization who are doing so much to increase the awareness of people.
Thank you.
People who are trying to conceive. Really.
Can I ask about laptops for men, right? Because obviously we live in a tech age. Our men, because we always hear about, oh, don't put your laptops on your laps. Is that right? Should men always have the laptops on the table?
That's a tricky one, isn't it? Because this is related to the temperature of the scrotum. Because the temperature of the scrotum has to be a degree lower than the rest of the body, or at least half a degree lower than the rest of the body to have the best production of sperms. And with increased duration of sitting, high intensity cycling, having laptops on the lab, things like this can increase the temperature, and that's why this has come up. And the common one is wear boxes rather than briefs. So I don't know how much this would this would not having a laptop on the lap would help. But yes, if they can avoid having the laptops directly on the lap so that the temperature is not high, I think that's a reasonable change that can be incorporated in their lifestyle.
Yes.
They can just keep it on a table instead of on their lap.
Yeah. And hot baths, slightly perhaps not so hot.
Yes, yes. Again, that has to be with the stool temperature. But a bath is a relatively short thing. But there have been studies that have been done to see whether a reduced temperature would have an effect. But what they found was that effect was temporary and not consistent. So we're still not sure how much it works. But logically, yes, it may have an impact, but not doing a certain thing, how much impact that would have is not what we are sure of.
But again, these are all like quite simple changes, quite simple lifestyle changes that you can make that would actually make you feel better because you're doing something to help your situation. It's a bit like if you were, preparing to, run a marathon or something, you would look at your diet, you would look at everything to get yourself physically ready. And my God, trying to conceive is a marathon.
Yes, it is, isn't it? Yes, absolutely.
So by making these changes, you can actually improve your fertility. Can we say that?
Yes, by having the appropriate lifestyle modifications, we can improve several aspects of our fertility. Absolutely, like weight and like alcohol and having a proper diet. We can definitely reduce the impact that these lifestyle aspects have on the fertility. So yes, by making simple changes, we can definitely optimize our chances.
Yes. And how long would you say until you would see a difference in a patient in terms of their fertility? How long would this all take?
That's a tricky one, Sarah. For example, with weight, every person would take a different length of time before they would, have a change in their weight. But weight loss of as little as 5 to 10% would make an impact on their fertility. They could see that the fertility would be better and their chances of conception would be better, even though they may not have reached their ideal BMI. As far as smoking is concerned, smoking alcohol, I think it's clearer in the men where the cycle required, the length of time required for a sperm to be produced is about 3 months. So you can expect an impact in maybe 12 weeks time. But in women, it's a little more difficult. It's more gradual and more difficult to distinguish when the difference happens.
Yes, but basically start as soon as you can.
Absolutely.
Start as soon as you can. Make those lifestyle changes and then get tested.
Yes.
Again, something I wish I'd done a lot sooner, because once you understand that there is a problem, or then you can react on that and speak to your doctor and move forwards, because time is of the essence when you're trying to conceive. Don't wait. Yes,
so time is of essence, and which is why awareness is also of essence. So once people are aware that what is the crucial things that they need to do before before they start trying, or the crucial things that they have to keep in mind before they're ready to start trying. That would help them to make that decision as to how much time they have before they have to start trying.
Yes. And for anybody who might be watching this who hasn't yet been to their doctor or looked into a fertility clinic, can they call Art Fertility and perhaps just talk through where they're at, what they're what they're thinking, just for some guidance on what these steps are?
Oh, absolutely. They're most welcome to contact us, and we would be happy to help them in any manner we can, in terms of what they can do, even if they're just starting to plan. and what they need to do if they don't conceive in the stipulated time.
That's amazing, because I think sometimes people are fearful that, you know, they'll make a phone call and then suddenly they're committed and locked in. But we're constantly saying to people, my gosh, no, just make that phone call, have that initial chat. It's not a commitment, but it's just helping you get some clarity, you know. So yeah, that's really good to know.
Yes, and especially in this Corona times, I think that is one silver lining, because almost everyone has started offering free tele consultations. So yes, video or audio consultations are on offer for anyone who wants to ask any questions.
That's just brilliant. Thank you so much for your time today. Those key elements, those key lifestyle changes, you know, can yeah, well, create such a difference, and it's really, really good just to talk about them. And by the way, I'm taking this with me today when you said that no, every finger is different and people are the same. I've never heard that. I'm using that. Well, listen, thank you. And I would love to pick your brains again on another day.
Oh, you're most welcome. It's been my pleasure. Thank you so much for having me.
Thank you.